Thank you. I would like to recognize and acknowledge the organizers for giving me this opportunity to present findings. So I'm going to present findings on correlates of long-acting reversible contraceptive, which in this presentation will be referred to as LARC use among young women in Southern Africa. And this was a secondary analysis from the HPTN 082 trial. So before I begin, I would like to take a moment to acknowledge that HPTN is the HIV Prevention Trials Network, which has a scholar program which gave me funding to do this secondary analysis, and I would like to acknowledge them, as well as acknowledge the mentors who have helped me through this process. I also thank you for your attention, given that this is the last day. So LARCs, in this case, we are looking at IUCDs, injectables and implants, have several advantages. They are safe, highly effective, user-friendly with minimal side effects. They have low discontinuation rates, and there's no need for daily adherence, making them ideal for young users. However, despite these advantages, their uptake remains low amongst adolescent girls and young women, even though we know that unintended pregnancies are high in this group. Therefore, we sought to understand the barriers and facilitators by doing this secondary analysis. So briefly, HPTN 082 was a study which evaluated the uptake and adherence to daily oral PrEP as a primary prevention strategy for young African women. 451 HIV-negative adolescent girls and young women aged 16 to 25 were enrolled in this study. They were non-pregnant. They should have had vaginal or anal sex in the month preceding screening and should have had interest in taking PrEP. This study was conducted in South Africa and Zimbabwe between October 2016 and 2018. The visits that occurred were scheduled at week 4, 8, 13, 26, 39, and week 52, which corresponds to month 12. Therefore, follow-up in this study was for 1 year, wherein HIV and pregnancy testing were done. So in this study, contraceptive counseling was done as well through week 39, and women had the option to initiate, decline, switch, or discontinue a contraceptive method. So the objectives of my research, the secondary analysis, I sought to evaluate the correlates of LARC use in this population of South African young women at screening and over a 39-week follow-up period, because contraception was given for that duration. I also sought to describe the frequency and patterns of contraceptive switch through the week 39, as well as determine whether LARC use at enrollment was associated with condomless vaginal sex during the 52-week follow-up period. So this is just the baseline characteristics of that population. We divided the groups into those that used LARC at baseline and those that didn't use LARC, and there was similarity between the groups, and in this case I considered level of education and age. I'll not go so much into the details. This slide, what is significant is that on looking at the demographic and behavioral characteristics, for the girls who had ever been pregnant, we realized that more of them actually opted to use LARC with a p-value of less than 0.01, as we shall see ahead in our findings. So this is the gist of the matter, the results of this analysis, because the primary objective was looking at the predictors of LARC use. And significantly, what we found is that those who were comfortable talking to close friends about sexual relationships were more likely to use LARC. And also, those who had ever been pregnant before were more likely to use LARC. As well as, remember the third objective was about condomless vaginal sex. So those who never used condoms were more likely to use LARC. Yes, I hope I brought it out clearly. So in the discussion, as I conclude my presentation, we see that LARC use among young African women was associated with talking to peers about sexual relationships, having condomless sex, and a history of a previous pregnancy. Therefore, we see that peer support is important in shaping adolescent girls and young women's contraceptive decisions, as we have seen in all the discussions we had, that peer support is very important in most of their decisions. Also, just to explain why possibly a previous pregnancy could contribute to higher LARC use, we believe that after an unplanned pregnancy, the young girl will be introduced to a healthcare system which would expose them to knowledge about contraception. And then regarding the condoms, since LARC users are less likely to use condoms, it's important for us to look at integrating HIV prevention options like PrEP with reproductive health services as a way of providing comprehensive protection against both unintended pregnancies and HIV. So what are the implications? What are the future considerations? We believe that integration of HIV and sexual and reproductive health services into existing primary health care services remains a key service delivery model to implement comprehensive and complementary HIV and sexual and reproductive health services for adolescent girls and young women. And also we know that now we're in the era of multipurpose prevention technologies. This may be a game changer for the prevention of HIV and pregnancies for adolescent girls and young women. So from this particular study, HPTN 082, this is a study which combined both PrEP and contraception options. So in this study, we learned that, so they actually did integrate both services. They gave the PrEP as well as offered contraception and contraceptive counseling. So from this study, we learned that integrating HIV and sexual and reproductive health services for adolescent girls and young women can enhance comprehensive care by providing access to PrEP and LARCs, along with tailored counseling and support during follow-up visits. This approach actually improves health outcomes and empowers adolescent girls and young women to make informed decisions. In summary, the key question was looking at the factors associated with LARC use among young women in Southern Africa based on data from the HPTN 082 study. And the key findings were that in this cohort of HPTN 082, 60% of adolescent girls chose a LARC method. And the key factors that were linked to LARC use included having a prior pregnancy, feeling comfortable discussing sexual relationships with close friends, as well as engaging in condomless sex. So how important is this for HIV prevention? Integration of HIV prevention within sexual and reproductive health services is key for adolescent girls and young women in sub-Saharan Africa. So as I conclude, I would like to acknowledge my mentors and the statistician, as well as the funders and the HPTN 082 study participants. Thank you so much for your attention.